Thank you all for being with us this evening. My name is Jim Hess. I'm with Let's Play Books Bookstore, and we are proud to be hosting this evening's book talk. The topic of conversation tonight is crisis and care, queer activist responses to a global, global pandemic. And with us this evening are Adrian Shanker, who is the editor and a contributing writer to the book. And he will be in conversation with Vicky Kistler, who was recently appointed the director, the director of Community and Economic Development for the city of Allentown. Before I introduce a little further our guests, I did want to just share a little bit of information with you. We have signed copies of the book available for purchase. You can give us a call at Let's Play Books in Emmaus, Pennsylvania, or visit the shop. You can also visit our website at letsplaybooks.com, and we will be sharing that link in the chat. And anyone who's with us this evening, or anyone who registered for the first program that we had scheduled a couple of weeks ago, will get 25% off their purchase. And that does remind me that I did want to apologize to folks who tried to join us before when we had technical difficulties, but we're glad you're with us this evening. This session is going to be recorded. We will be sending that recording or a link to that recording to everyone again who's with us this evening, as well as those folks who registered for the first earlier session. And with that, I'd like to now introduce our guests to begin tonight's program. Adrian Shanker was the editor of the critically acclaimed anthology Bodies and Barriers, Queer Activists on Health, and the former executive director of the Bradbury Sullivan LGBT Community Center here in Allentown. And there's a copy of Adrian's previous book right up behind me. We can do signed copies of that book as well. Adrian is a specialist in LGBT health policy and has developed leading-edge health promotion campaigns to advance health equity through behavioral, clinical, and policy changes. Adrian is currently the executive director of the SPAR Center in Marin County, California, and they're lucky to have him out there. Vicky Kistler, as I mentioned, was recently appointed as Director of Community and Economic Development for the city of Allentown. Vicky previously served as the Allentown City Health Director for 14 years and also the city's Communicable Disease Program Manager for 14 years. So all told, Vicky is now approaching 30 years of service to the city of Allentown. I'd like to thank them both for being with us this evening and turn it over to them for this evening's program.
Thank you so much, Jim and Kirsten. I love Let's Play Books and so glad to do this event with you, at least virtually. And Vicky, it's so nice to see you.
It's good to see you as well, Adrian.
And wow, 30 years for the city of Allentown. That's incredible.
Thank you. I feel old.
Thank you. Well, Allentown's healthier, so as a result. So the book Crisis and Care is really about a number of things, including what the beginning of COVID was like. But it's really more than that. This is a book that takes a look at the first 2 years of COVID, but about how LGBTQ folks responded, more than about what the virus itself was like or a history of this period of time. So I'm going to start with a short reading from one of my chapters in the book. And then Vicky and I will be kind of in conversation and happy to also take some questions from anyone attending as well. This chapter that I'm going to read from is called Reopening the Past or Reimagining the Future. Rabbi Morgan Forrest, a queer Jewish disabled study partner of mine, shared, "The one thing COVID brought me was this period of time when the doors of online connection were wide open. I fear that once everyone goes back to their usual and customary pre-COVID routines, those of us who are disabled, health-challenged, or homebound will once again be forgotten and left behind. There's no contemporary roadmap for what happens after a pandemic. Does a light switch flip and everything return to pre-pandemic times? Is that even possible? Is it a good thing, even if it were possible? And what do we say to those who found solace, community, and connectivity in the virtual world that COVID necessitated? To be sure, the social isolation of the first year of COVID was not easy on anyone. Early in the pandemic, people joked that introverts were preparing for it their whole lives. But with what felt like no end in sight, the mental health challenges of prolonged isolation began to increase. Our communities transitioned quickly to create virtual programs, online communities, connections across time and space. We radically reimagined communities to create connectivity in the cloud. This was our COVID resiliency, and there's no reason for it to end as the world reopens. Even as I longed for a return of in-person connections, travel, gatherings of friends and family, all of which were precluded by the pandemic before the approval of vaccines, I hated to hear people longing for a return to normal. Pre-COVID normal was inflexible and competitive. The pandemic required mutual aid and an abundance of community care. Pre-COVID normal was capitalistic and punitive. The pandemic required activists to call for an end to evictions and the release of incarcerated people from crowded prisons. So yes, with the reopening of much of our society after many people could access the COVID vaccines, the human desire to hug each other again was palpable. But instead of simply reopening the past, we have an opportunity to reimagine the future based not on what we once knew existed, but instead what we now know to be possible. In When Brooklyn Was Queer, historian Hugh Ryan writes, "I look forward to a future where we also have a past." When we engage in the creative and radical act of reimagining, we remember both what worked and what didn't work before and during COVID. We can imagine a future where access to community can be bridged across geography and ability, a future where instead of prisons or police, we invest in community-driven models for accountability and restorative justice. We can learn from the vaccine distribution efforts and imagine a future where we always consider people with underlying health conditions first. We can learn from mutual aid networks to imagine a future where we all take care of each other. The individualization of the normal from pre-pandemic times may not work for us as we move forward. COVID reminded us that all we really have is, in fact, each other. Likewise, COVID didn't create the disparities that left Black, Indigenous, and other people of color, queer, and disabled communities behind. These disparities long existed. COVID made them worse. But throughout the pandemic, queer activists responded with care for each other and our communities. Queer organizations found that through virtual programs, we could reach community members who were never able to participate previously, when access considerations were not considered. As the broader society learned that reopening with an equity lens requires centering the needs of historically excluded and minoritized populations, queer organizations were reminded of this as well. Many organizations opened with hybrid technology, maintaining connectivity for disabled community members. A reimagined future empowers us to rebuild from the margins. COVID taught us that the greatest threats to our society might or might not be a virus that none of us can see. It might be the parts of normal that we grew accustomed to, and that we've learned we don't want to take with us into the future. COVID was traumatic and deadly. There's no silver lining to a dangerous virus. But throughout the pandemic, we learned to care for each other in new and creative ways. We learned that in a reimagined future, we don't have to leave anyone behind. We learned how to respond to a crisis with care. So that's a little bit of the framing of this book. And I have to say that throughout especially the first year of COVID, Vicky was the person who was really working night and day around the clock to ensure that the city of Allentown and the broader region, because COVIDs don't actually know how to read, like viruses don't know how to read maps, so they don't stop at city borders. But Vicky was really working really hard to ensure the safety of Allentown residents. And at the time, I was leading Bradbury Sullivan LGBT Community Center, and we talked frequently about how to keep our community safe from COVID. And so, Vicky, I'm wondering, like looking back on the beginning of the pandemic, what are some lessons that that you would take into the future because COVID unfortunately won't be the last virus, right? That we know for sure. So what are some lessons from the beginning of the pandemic from your lens as the city's public health officer at the time?
Well, I'd like to start by saying we need more than one roll of toilet paper in our house at any given time. So we learned supply and demand, that we had preached emergency preparedness for so long to say, make sure you have an adequate supply of your medications, make sure that your house is stocked with what you need, always making the assumption that people can afford to do that, which wasn't really a good assumption to make. But if you can, to keep critical medications and critical supplies, stocked and stocked well. Um, we learned the power of relationships, and I think that's one of the most important lessons we learned. And that was that we saw neighbors caring for neighbors, checking on each other, shopping for each other, people in quarantine or isolation, reaching out to organizations who did deliver and make sure that they were okay, or place orders for folks that weren't able to do that on their own. We saw volunteerism like I've never seen before. People enrolling, people coming through our vaccination site and saying, how can I help? And enrolling in the Volunteer Medical Reserve Corps to come back for shift after shift to help others have the same process. We also saw non-traditional organizations working together. Large venues opening their doors. They were always entertainment venues, or they were hotels, or they were fun places to be, convert into medical operation centers. So the idea of preparing and pre-creating those relationships was really beneficial. We saw many of those things, but I think by far the biggest thing we saw was the importance of people being connected to other people on some level.
One of my favorite things that we got to do together at the beginning of COVID was to actually work on a sexual health guidance for the city. And in the very beginning of COVID, the message from the federal government was stay home, right? And the message that we were hearing from every hospital in America was saying stay home, and stay home for sure had its moment. In this book, Emmett Patterson describes the stay home moment as abstinence for our full lives. So not just sexual abstinence, but abstinence from all human physical encounters. And a few months later, the New York City Department of Health, and this is actually detailed in this book. I'll share a small piece of it, but the New York City Department of Health released a sex during COVID guidance that we then brought and worked on with you in Allentown, and then in a number of other municipalities and counties across Pennsylvania before Pennsylvania actually adopted its own sex during COVID guidance. And what was so interesting about that moment for me, Vicky, was that there were some folks, mostly folks not in public health, who were saying like, well, we said stay home. Like, why do we need a guidance about sexual health during the pandemic? And working with your office on creating risk aware, what we in the queer community would often say, like, risk aware decision making, information to help people make their own decision based on what their own needs are, realistic needs. So being able to work on that with you was really important. I'm wondering if you have any reflections of that work. And it's not dissimilar from work that happened during the HIV epidemic either, where there was conversations about how do we tell people how to stay safe at the same time as we're trying to reduce the spread of a virus.
I do remember that, Adrian, and I do remember the thought process and the gut feeling that I had about the need for a document like that. All they kept saying during COVID was it's a novel virus. It's a novel virus. We don't know. There's a lot we don't know. There's a lot we don't understand. But there really was a lot we did know. Like, we did know about disease transmission. And even though, we had a lot to learn, we also knew a lot about human behavior. And we knew that it's easy to say and issue orders and directives about, stay apart, stay safe, don't go out of your home, don't, be with others. But some people are calmer and better equipped to handle an emergency if they have a plan and if they have some clear-cut guidance on what's safe and what's not safe. So I was really happy when you reached out about that document. I had not seen New York's at the time. You, I think, were cutting edge to have found it. And I thought it was really important work. It's important for us to acknowledge that people are human and that, it's a very common behavior for people to want to be together on sexual intimacy or on any other level of intimacy, and that we needed to acknowledge it and we needed to step out in front of it.
So in the book, Emmett Patterson, one of the contributing authors, has a chapter called "Building Our Queer and Quarantine Sexual Worlds," and in it he has a part of the chapter where he asks, "Who's the public in public health?" And he writes, "What do we mean by public health, and how does sexual liberation play a role?" Alexander McClellan, the co-founder of Policing the Pandemic Project, describes the way in which queer people and other marginalized people have historically been removed from public health. Quote, "When we talk about public health, we have to think about who is the public in public health and whose health is being protected. And when we play that question out, we find that people living with HIV or queer people are never the public in public health. They're always the subject who the public is to be protected from. So we're framed as objects of risk that the public is to be protected from." Then Emmett continues, "To be marginalized is to be excluded from the very definition of public health and thereby its efforts. But aren't we part of the public who needs protecting too?" And that framework was something that really was relevant to that work, in my opinion.
I agree. And those of us who've worked in true public health endeavors for our careers were extremely concerned for our marginalized populations. We know that the LGBTQ population has been disproportionately affected by many diseases, not just HIV, but has a higher propensity to smoke, which means they have lung ailments, or has issues with obesity, and that means they have cardiac ailments. So we were very worried, not just about the LGBT population, but about persons with comorbidities that would make them far more susceptible to serious outcomes from COVID than perhaps other populations.
Yes, and that will be the case with future things too. I mean, we're seeing that play out right now with monkeypox or mpox. I'm using both because some folks may not see the news with changes of names of some of these viruses, but we're seeing this debate kind of play out about if we should be talking about mpox as in terms of its disparate impact on the LGBT community, and some other folks saying, this is not a gay virus, and both are true at the same time. And I think a lot of what we learned from COVID is playing out with the mpox response. We are prioritizing the people who are most at risk for vaccines. I'm sure that Allentown's doing the same as other places, but that was a struggle at the beginning of the COVID vaccines, a lot of fighting about who should be prioritized. And right now we're not really seeing that fight play out. Is that your experience as well?
It is. And I think the sooner we stop labeling widespread groups of folks and we start to look at how disease affects human beings, and we look at the conditions that human beings experience, the better off we'll be at communicating regarding these situations. It's true, it's not an LGBTQ disease. However, it disproportionately affects certain populations. So we walk this fine line about how, what we call things. And again, I think we need to stop worrying about what we call it and start looking at, as you said, the risk, and making the risk more calculated and making the outcome more predictable.
Yeah, I agree with you. One of the most interesting, in my opinion, chapters in this book is by Zephyr Williams, who at the time was the managing director of a national organization called Black and Pink, which supports LGBTQ people who are incarcerated. And Zephyr wrote, "COVID-19 made visible what those of us on the ground, community organizations and activists alike have known for years. Prisons and jails are dangerously overcrowded, unhygienic, violent and dehumanizing institutions. It wasn't a question of if COVID would spread through correctional facilities, but when. Jails and prisons are not designed for people, let alone preventing the spread of a deadly virus. Social distancing is near physically impossible in an 8 by 6 foot cell crowded with people. Meals are mostly communal, with incarcerated people sitting elbow to elbow. Personal protective equipment and cleaning supplies were in short supply. Frequent hand washing is difficult because soap is not readily available. Most people on the inside are not provided with soap. They have to buy it from commissary. During COVID, correctional facilities simply didn't have it. In many facilities, alcohol-based hand sanitizers even considered contraband. And Zephyr goes on to talk about the unique work that their organization did to support LGBTQ people, especially transgender people and people living with HIV, to protect them from COVID if they were incarcerated at the time. But I'm wondering what your experience was like trying to manage public health prevention efforts with there's a jail in the middle of Allentown, right, downtown Allentown, I'm wondering if any of that resonates in terms of what your experience leading the Health Bureau was like at that time.
It all resonates. Prisons are typically county prisons, especially if they're small, in small communities. And they're underfunded and they're way understaffed. And we know that. We've had numerous tuberculosis outbreaks and other disease situations that have occurred in communal living situations. And our prison happens to have a professional corporation, an outside company that deals with their medical. But all of us knew from the get-go that no matter how good your medical services are, when you cram a ton of people into a small space, a disease that passes through airborne methods isn't going to be contained. So we all knew from the get-go that the prison was going to be a hot spot. We were taken very much off guard by how many other hot spots we had involving many of the same population. Many people who are released from prison end up in a homeless shelter, which is just as overcrowded with just the same types of inability to isolate and to separate. So they're huge challenges, and we have not handled them. We had a meeting just yesterday with our local shelters about the creation of space to be able to isolate people who are ill from people who are well. I don't know that conversation has gotten anywhere in the prison. They do have isolation units, but they're very, very small. So I think we've got a long way to go with our corrections care in the United States to truly address something like a COVID outbreak in a prison.
So this is obviously an ongoing pandemic, and even though this book kind of takes a look back at the beginning of COVID, I'm trying to be careful to make sure I talk about it at the beginning of COVID, not COVID's over, because we know it's not over. And there's a new vaccine out that it's not just a booster; it's a totally new vaccine, and there will likely be future iterations of that as well. We saw the Surgeon General actually put out a video, I think it was today or yesterday, talking about how we may even have an annual COVID vaccine in the future. One of the conversations at the beginning of COVID was about vaccine hesitancy and medical mistrust. And in this book, Kenyon Farrow, who is a really prominent Black gay activist in Cleveland, wrote a chapter, 4 Things We Must Do to Fight Medical Mistrust After COVID Ends. And one of the things that he wrote was, public health is due for its own reckoning. We not only have to reinvent the language we use, we have to be willing to reimagine strategies around contact tracing and partner notification. The current strategies have resulted in people being fearful of engaging in public health, especially when biometric companies are already positioning themselves as the solution to getting out of lockdown, offering many more ways for people's human rights to be violated or for data to be collected by unaccountable profiteers. Instead, we should more readily bring the kind of bioethics framework and protocols that exist in biomedical research into public health. Doing so would be a useful tool to help shift public health institutions into thinking more critically about how their practices do or do not align with the human rights approach. As a public health community, we have a lot of work to do. We will roll out vaccines, and I think most people will eventually take them. While COVID may become a disease of the past, we can't rest on our laurels. We have to do the ongoing work to transform the role of public health and make it visible and something people can relate to. And Black public health practitioners have to play a leading role, especially where our communities are impacted. I'm hoping new leadership in federal agencies will make this possible. I'm also hoping my fellow social justice warriors who've long ignored HIV and other public health issues will continue to see us as allies in the work of building the world and society we all want to and can live and thrive in. He's talking about the conversations that we were having at that point in the pandemic about if certain parts of our community would be more hesitant than others, right? And that's obviously a huge concern for public health workers, right? But in a community like Allentown that is, majority non-white community, it had significant implications. Any thoughts on what we learned from vaccine promotion in Allentown with non-white communities and how that might impact, efforts around this new COVID vaccine, for example?
We definitely learned that trusted messengers are important in communities. Physicians who stood up, who were physicians of color, physicians who stood up, who spoke the languages of the population, were extremely helpful in addressing head on the situation with vaccine hesitancy. Also, taking vaccine where people are comfortable receiving it. Some of the best vaccination clinics we had were at grocery stores, or were not in a true medical facility, but were out in the community where they were convenient. They were on a bus route. They were at a time when you could walk up without an appointment. They were made to kind of fit into I see my neighbor Jim at the grocery store and he's getting a vaccine. Maybe I'll jump in the line and get one, at the same time. So breaking down some of the traditional barriers, I think were really important. But the fact of the matter is we have a long way to go to build trust in the community. And I'll be honest, we don't seem to have a great plan for how to accomplish that. We spoke out and we saw the mixed messages that came out of large federal agencies. We saw the battle between the political side of COVID and the medical side of COVID. And I think for one of the first times in our nation's history, we really truly saw a significant chunk of the population stand up and doubt physicians and medical care and doubt everything they said, which made the challenge even bigger. You saw the analogies come out on Facebook when people would say, okay, so masks don't work. Tell your surgeon when he's, transplanting an organ to take his mask off because he doesn't need it. Those kinds of things. And that was extremely scary to public health professionals because although this was a deadly virus, we have things that are far, far deadlier that are going on in parts of the world where we have a lot of travel. So we could at any given time have Ebola or have something, God forbid, that's, even more deadly. And we had a really, really hard time getting people to cooperate with something as simple as keep an arm's length distance in the grocery store. So it's, this is really an eye opener for those of us in public health that we have a long way to go to get folks to understand that we do the best we can in the moment and we learn as we go sometimes, but that's the nature of medicine.
From my lens as an activist who was in the city at the time, I was really impressed at how people really did take care of each other, and really did, many people really were trying to, step up and be supportive, and from hand sewing masks to give to their neighbors at the beginning, right, to people going grocery shopping for folks who were more at risk. And that kind of care for each other is something that we should always remember. And frankly, we should apply it to other aspects of our lives, even when we're not in a pandemic.
Absolutely.
That's, I think, one of the biggest takeaways that I was hoping comes out of this book is that we learned how to care for each other, and we can't forget how to care for each other, just because it doesn't feel existential every day. At this point of the pandemic, for many of us, it doesn't feel existential every day. Many of us are going into the office to work, going to hang out with people, and traveling, those kinds of things are back in our lives. But we did have this moment where we learned how to take care of each other. Um, you know, um, and also organizations adapted. So, I was leading Allentown's LGBTQ center at the time. Now I'm leading a center out here in the San Francisco area. And there's a chapter in this book about how LGBT centers kept communities connected. But at the beginning of the pandemic, really, LGBT centers, for the most part, weren't great at technology. And I think actually the nonprofit sector wasn't so great at technology. Many of us had never used Zoom before as agencies. The role that LGBT centers, including Allentown Center, played was first learning how to pivot programs virtually, but then it was using technology to create really incredible public health messaging, videos on YouTube, learning how to do Instagram Live information. At one point, a drag performer was hired. I have a picture here. Mandy Mango, who is also a public health nurse, actually. I'm going to show you the picture here is Mandy Mango as the coronavirus. And there was another one. Was hired by Bradbury Sullivan Center to make videos that, like you just talked about, trusted messengers, drag performers, videos telling people how to have brunch outside safely during summer 2020, or videos telling people how to wash your hands for the right amount of time, or the variety of different messages that we needed to send. We found that it was really effective to have a trusted messenger, a drag messenger in this case, be the one teaching people how to wash their hands versus somebody who looks and acts like a public health provider making a YouTube video while they're washing their hands. Maybe those are some lessons that can get applied in the future as well. But that was definitely my first time thinking about the intersection of messengers in our community to share public health messages like that. I don't know if you recall prior experiences with it, but for me, that was the first time that I really thought, oh yeah, we can hire a drag queen to teach people how to wash their hands.
We absolutely, we thought back to the HIV/AIDS, the onset of the true understanding of transmission with HIV and AIDS, and how much we needed folks from the LGBTQ community to stand up and encourage folks to get tested, to be brave enough to actually walk through the doors and get a test. And I equate this to that. We needed every group to come out and find their role. And, you did that so well at Bradbury Sullivan. You found your role to find ways to use the trusted messengers, but also to provide the safe haven where people could get a test or could come to get information or could ask questions. And that becomes so important. We had a lot of agencies simply shut down. And then we had others who, although their doors may have been closed, their access points were wide open. And that's what I think one of the biggest lessons, became, was that there was a role for everyone in this. You just had to find it and you had to flush it out. And then once you found it and flushed it out, you had to hope that you could be contagious to others to get them to find their role, and that together everybody was working, toward the common good. And I think that was the coolest part of the pandemic, was that when you saw all of those partnerships come together, it's really what, being a human and caring about another human is all about.
There's no way to say that better. It's what being human's all about. Absolutely. So I'm going to share from the conclusion of the book, and then I'm going to turn it back over to Jim for some questions from folks who are listening in. First, Vicky, I just want to say thank you so much for being in conversation with me tonight, but more importantly, for really keeping Allentown safe during the scariest moment of my life and the lives of so many of us.
Thank you. It was a privilege. Yeah. I look at it as one of the best experiences of my public health life.
A friend who's a nurse in the Lehigh Valley actually at one point wrote on Facebook and said, Are healthcare and public health workers still heroes, or are we back to being regular staff again? And that was like the snarky comment about capitalism and the ways that workers were being treated later in the pandemic versus earlier. But we should, of course, remember the dedication and hard work of the public health workforce throughout especially the beginning of the pandemic, before a lot of info was known. So I'll share from the conclusion. Other books will surely detail the epidemiological failures that enabled COVID to wreak such terrible damage on our communities. This book seeks to present a different story: how queer activists responded to a crisis with care, compassion, resiliency, and results. The COVID pandemic taught us how much we rely on essential workers, delivery workers, healthcare workers, grocery store workers, and others. So after COVID, we should treat these workers like heroes every day, not only when we need to put their bodies on the line. COVID taught us how important universal healthcare is. Access to COVID testing, treatment, and vaccines were free for those without insurance. So after COVID, we should fight for a Medicare for all system, because healthcare is a human right, and our bodies deserve access to care at all stages of our lives. COVID taught us that prisons are a cruel and unusual punishment. They are literal petri dishes where physical distancing is impossible and hand sanitizer is contraband. So after COVID, we should fight to abolish unjust systems and create community-based models for accountability and restorative justice. COVID taught us that drastic changes are possible. Schools were closed, businesses were shut down. Even the US federal tax deadline was moved. So after COVID, activists should demand that the big structural changes our communities need. We can no longer pretend that change is impossible. We learned a great deal about how our society can be improved because of COVID. Now it's up to every one of us to radically reimagine our society so that the care and compassion we learned during the COVID-19 pandemic can be incorporated into all aspects of our lives. With that, Crisis and Care, Queer Activists on Health. And Jim, I'll turn it back over to you.
Thank you, Adrian, and thank you, Vicky. We do have a couple of questions. This book, Adrian, can you talk a little bit about how it came to be?
Yeah. So at the beginning of COVID, the very beginning of COVID, I'm talking about like April 2020, I started seeing really incredible Facebook posts from some activists around the country, people that, we were all still quarantining and isolating, and people were being very thoughtful with what they were thinking and writing. And a couple of those folks, I reached out to them and I said, we need to collect these stories. What if we turn this into a book? And so that's literally what happened. I was seeing what people were writing about and trying to make sure that we don't forget some of the most important acts of care and resiliency during one of the most challenging moments of our lives. And it's not about, by the way, I have to say that I don't think that the beginning of COVID is a moment any of us who lived through will ever forget. I think it's one of those moments that we will always remember, but we may not remember all of it. We may remember the parts that were really stressful, really hard. I want us to remember the acts of care and resiliency and compassion. I want us to remember how we supported each other, how we helped each other, how we protected each other, how we kept each other safe. And I was worried that we wouldn't do that if we didn't write it down.
Love it. Meg wrote, I loved Bodies and Barriers, your first book, and look forward to reading this. As a parent of a transgender teen, their health and wellness is a concern in normal times. Pandemic times, very nerve-wracking. Do you have any new books on the horizon?
Thank you so much, Meg. I'm so glad that you've enjoyed my first book, and I'm really excited that it sounds like you're going to read this book. And thanks for being a parent who is supporting your trans kid. Every trans kid should have supportive parents, and that's something our entire society should demand. No, I don't have any new books on the horizon, although I have chapters in a couple of other books, but I don't have any new books coming up. I think I need a break from books, not reading them, just writing and editing. Um, um, but in terms of your question though about parenting queer or trans teens during so-called normal times and pandemic times. Yeah, I mean, there was a point at the beginning of the pandemic where Vicky, you probably remember, where kind of healthcare was prioritizing COVID only, except for very, very specific, like heart attack style emergencies. But they were canceling what they call elective procedures. And some of these elective procedures were gender affirming care procedures, which are absolutely medically necessary and I would argue not elective. And I remember hearing from community members who said, I'm devastated because not only am I locked in place, but this surgery I've been waiting for 2 years has just been canceled. So that moment in time was really scary for a lot of folks. And also, I think we did understand that we didn't want to overwhelm the hospital system, but there wasn't a right answer. Every answer was going to be challenging. I think that as we re-enter so-called normal times, we should demand that access to care for trans and non-binary people is exactly what it should be: high quality, affirming care. We should demand the same quality of care that we expected for COVID related care and for any other like high emergency care. We should demand that gender affirming care is high quality, culturally affirming, accessible, affordable, covered by insurance, all of those things. So those are things we should absolutely continue to demand. And and in terms of being nerve-wracking, I mean, yes, and there will be other moments. I can tell you that the beginning of MPOX out here in San Francisco was quite nerve-wracking. We're talking about like right in the midst of San Francisco Pride, huge events that really haven't happened for years now because of COVID. And then right as it's happening, we hear about another another dangerous virus, different dangerous, but still dangerous. So, I think that the LGBT community has always had to be its own healthcare advocates, and we have to sometimes teach each other and learn from each other, as well as trusting and listening to public health and scientists and researchers. But at the beginning of MPOX, we saw, queer activists posting pictures of their MPOX lesions and to share with other people, to tell them what to look for, to also encourage people to stay safe, make risk-aware decisions in those ways. And that's something that queer and trans people have always had to do it during HIV, certainly during COVID, and now with MPOX, and there will be more in the future.
That does lead us into a question that we have from Liz. And I think Vicky and Adrian, both of you will probably be able to speak to this. Do you see any of the lessons we've learned earlier on in COVID being applied to stem the spread of the monkeypox virus, or are we just making the same mistakes again?
So I would first off, Liz, it's so nice to see you here. I would strongly suggest that we have learned a lot from COVID. Our top public health warrior for the LGBT community during COVID, the person who wrote New York City's first sex during COVID guidance, Dr. Dimitri Daskalakis, has been named by President Biden as the nation's deputy MPOX coordinator. He's the CDC website has very LGBTQ affirming information on it in terms of the spread of MPOX, and for both prevention as well as vaccine information. And we're not seeing any vaccine hesitancy for the MPOX vaccine. We are seeing questions about how to access the vaccine, especially in some rural communities, but we're not seeing people questioning if they should get it or not. For my first dose, I stood in line for 5 hours in Berkeley, California, and there was people standing in long lines everywhere, and then we actually have seen quite a big pivot with the change from subcutaneous to epidermal, vaccination to ensure that we can stretch the vaccine supply to protect as many of us as possible. And that kind of pivot is something that I think we saw really quickly. And so I do think that the response is different. We also saw LGBT community organizations jump right in because now we know how to do this. Now we know how to share public health information in a way that many of us honestly didn't before COVID. So I do think it's different. And yet, of course, there are challenges. Of course, there's frustrations accessing vaccines in certain places. But I think that what we're seeing is is a lot of lessons learned. Yeah, thank you, Liz.
I agree with Adrian that we are seeing some progress, but being the pessimist that I can be, I do think we have a long way to go. And I think that's evidenced by the fact that we still find ourselves ill prepared at times or short on supply at times. And for a nation with the resources that we have, we just have to do better. So I think we're moving in the right direction. We found companies that can pivot and can produce different vaccines and can respond very quickly. And I think we're learning every day how to improve that technology and how to roll things out quicker. So I think I agree with Adrian. We're definitely in a better place than we used to be, but I think we've got a long way to go.
Thank you. And I do want to share Meg's response, Adrian, to your response to her first question. She says, "Thank you. I was fortunate. My son had gender affirming surgery during pandemic, but not covered by insurance. As a mental health nurse and mother, I will work to do what I can for those less able to have the medical issues dealt with without concern for exorbitant cost." So
again, thank you, Meg, for being such an incredible parent for your kid, and we can hope that this is the last generation of trans kids who don't have who have to question if their parents are supportive. So thank you.
And Adrian, one of the things that I took away, or that from the book when I read it, was in your conclusion. I felt that you were optimistic, and you shared that a little bit, and I'm interested. We have some dichotomy, and I hope I'm not asking you guys to repeat yourself too much, but you talked about the possibility and potential for meaningful change. Could you talk a little bit about that?
Yeah, I mean, in general, I think that we have a choice about how we want to see the world. And I'm choosing to see the world in an optimistic way. But I don't blame people who are not optimistic right now either. I understand. But for me, I'm choosing to focus on the lessons that we've learned that we can take with us, so that we can create a more caring society in the future. I think that for me, for my own life, that's probably more helpful than thinking about everything that went wrong during the pandemic. Of course, there's lessons there too that can also be applied to prevent the spread of future viruses and to improve things in the future. But I'm trying to do it through an optimistic lens, and by saying, like, this is what we learned really well. When we saw, Admiral Levine at the beginning of the pandemic with her daily reminders, and for the first time in the 16 years I lived in Pennsylvania, people knew who their Secretary of Health was, frankly, we should remember how to wash our hands after the pandemic too. But what I'm more concerned about is we should remember the lessons that lead us to be, a more caring society, a society that takes care of each other. I said it in the conclusion, but all we really have is each other.
I agree. Vicky, any reactions?
Yes. Some people really truly didn't know what to do. They wanted to do something and they didn't know what to do. And almost every community has a medical reserve corps. And although it's called a medical reserve corps, it's really a misnomer because although it responds to medical situations, it's really a combination of medical and non medical folks. And what we learned is that we needed folks from all walks of life to address this public health issue. And that medical reserve corps just rose to the occasion, not just for COVID. We call them out to line a river when we have a missing autistic child so that the kids drawn to water are caught by a caring volunteer. We call them out when we have a missing Alzheimer's patient and we need to comb the city streets. We call them out when our first responders need to practice rescuing people who are stuck upside down on a roller coaster at Dorney Park. We call them out simply to train, to learn, and to build community. And we started out in the pandemic with 140 registered volunteers. We ended the pandemic with well over 350 very active volunteers. And we couldn't have done the response in Allentown. We couldn't have vaccinated so many people without them. So, one of the things we learned is that together we can do a heck of a lot more than we can when we're divided. So, for people who are on the fence about how to get involved, um, look back at those lessons learned and join one of the agencies who delivered diapers and formula and grocery shopped. Join a medical reserve corps. Get connected to a group. And I think that, like, Adrian's optimism comes from the fact that his life's connected to other people and it's focused on other people more than it is on his own. So I think the more that we do that, the more we can see the optimistic part of situations and we can rally together to make the outcome different.
I remember a moment in the beginning of the pandemic. This is in the time when we were still wiping down our groceries. When I was getting my groceries delivered from a farm in Lehigh County, Crooked Row Farm, and they would just deliver them to me. And at one point, the farmer sent out an email to all of her customers and said that the grocery stores and food pantries are having a shortage of fresh vegetables because of some supply chain issue. I don't remember the details. But the grocery stores aren't able to source from local farms because of some other reason. And instead, what she's trying to do is to donate packages. She had a surplus of carrots, and she was trying to donate carrots to the Parkland Food Bank or something like that. And so she invited her customers to pay for an extra bunch of carrots that would get donated because her carrots were going to go bad and the pantry was empty. And that was just an example of like such an easy way that people could support each other and support a local farmer and also support people who didn't have food and folks like me who could afford to buy an extra bunch of carrots, right? And I think that those are the kinds of lessons that we can think about in the future as well, like in all aspects of our lives. Like how do we think consciously about caring for our broader community?
Well,
So
and
anyway,
Adrian, can I add an example right now?
Yeah.
COVID is not over. In fact, we're seeing a resurgence thanks to going back to school and kids being out and about. And almost every commercial insurance plan right now allows each and every insured person to go to the grocery store or pharmacy and get up to 10 free COVID tests per month. And many people don't realize they have that benefit. Or if they do, they've stockpiled 20, 30, 40 tests underneath their kitchen sink just in case. We're encouraging folks to utilize that benefit. You're paying for your health insurance in most cases, and then donate the tests they don't need to the shelters so that they can screen folks and prevent a subsequent outcome or a subsequent outbreak of COVID. So if you have that insurance, it doesn't you don't pay a deductible, you don't pay a copay. They're 100% free with most commercial insurances, even Medicare, and they'll ship them to you free on Medicare. That if you donate the extras, it helps to screen those folks coming in on a daily basis and make sure that they don't have an outbreak.
That's such a great act of it's such a great example. Yeah. Um,
And it's wonderful to hear you both share those examples. And this book, the topics and themes of this book are, of course, important in so many other things that are going on in our society right now. I'm reading How to Prepare for Climate Change by David Pogue, and there is overlap in his book. You know, he talks about some of the issues, Adrian, that are in your book, and it's important stuff, and it's
yeah.
it's I think we've heard a great kind of dual view of the optimism going forward that we can make important changes to make improvements, and yet it's a steep hill. We've got a lot of work.
I would actually argue that crisis and care is not really about COVID. It's about times of crisis, and it uses COVID as an example of a time of crisis. But there's other inflection points for crisis in our country, in our society, and climate change in some areas is absolutely one of them. Just north of me, there's wildfires, right? Those are crisis points. I mean, so the lessons of this book can be applied to so many areas of our lives, including climate justice issues as well. And so crisis and care. Thanks for listening.
Yes, absolutely. Thank you, Adrian. Thank you, Vicky, both for being with us tonight. Folks, remember, Crisis and Care signed copies available at Let's Play Books in Emmaus and at letsplaybooks.com. We can also ship them all over the world, really, through bookshop.org. And we have a website on that. And I want to also remind you about Adrian's previous book. So thank you for being with us, everyone, and have a wonderful evening.
Thank you. Bye.